Imagine getting access to potentially life-saving medical care or screenings in the same place you buy shampoo. But thanks to the power of artificial intelligence coupled with advances in telehealth, things like this are already happening.
Every aspect of healthcare is either already being touched by AI or will soon be.
On this episode, we dive into how AI is transforming healthcare and why states are better equipped to lead out on public policies that both protect innovation and improve the patient experience. You're listening to Defending Ideas. Defending Ideas is a weekly podcast produced by Sutherland Institute. On this show, we are committed to renewing the principles of common sense conservatism, making you a better champion of sound ideas. Welcome back to another episode of Defending Ideas. I'm your host, Nic Dunn, and my guest this week is Naomi Lopez. She's the founder and principal of Nexus Policy Consulting and public advisor for Paragon Health. She's also a scholar, has affiliations, done some great work with the Goldwater Institute, the Mackinac Center for Public Policy, and the Beacon Center. So many organizations like Sutherland around the country doing great policy work. So Naomi, thanks for joining us and welcome to Defending Ideas.
Thank you so much for having me today.
I'm excited to talk to you because we're kind of doing a mini series, if you will, on artificial intelligence and how it's impacting various aspects of public life and how we can kind of harness this new technology in a way that promotes human flourishing and upward mobility and improves a wide range of policy areas that we talk about so often on this show. And I wanted to talk to you because of the work that you've done on AI in healthcare in particular. And to kind of start off, I'd love to just get your general sense of how you view this issue broadly. Of course, whenever we start talking about AI, there's images of Terminator or the iRobot movie. I'm partial to myself, enjoyed that one. You know, all of these sci-fi depictions of AI or robots kind of rising up and destroying humanity. In real life, it's a lot more optimistic than that. There's a lot more cause for excitement, but we still want to make sure we get it right in the policy landscape. So what are your general thoughts? How do you view AI generally? And then how do you feel about it in the healthcare space? Are you excited? Are you a little nervous? Maybe a little both? What do you think?
I'm so optimistic about what AI could possibly mean for people in their everyday lives, improving their lives, making healthcare more affordable and accessible. When you think about how the internet has impacted our lives over the past couple of decades, what I predict is that AI will do that but tenfold for us in our daily lives. So, you know, whenever we're talking about the healthcare experience, what it might mean for a patient, for example, imagine an easier time scheduling your appointment with your provider. Imagine being able, in some cases, to get a remote diagnosis and a prescription filled seamlessly without a lot of rigmarole, without having to get into your car, doing it after hours. Whenever we talk about more serious illnesses, the ability of AI to diagnose and provide treatments will change very dramatically going forward. So I think that every aspect of healthcare is either already being touched by AI or will soon be. The Food and Drug Administration has already certified or approved 1,000 devices that are either AI or machine learning assisted devices. And so this is all moving very quickly. And I know that there are concerns. And of course, we need to be rational about those concerns. But I think what we're going to eventually see is regulation, hopefully based on risk. For example, an AI that might be able to alert your doctor that you're an AFib, for example, because you have a wearable, is going to be a different risk level than a large language model that could develop a new and unique molecule. So that would be regulated differently. And I think that that's really the more rational approach. That's the way that we will be moving forward, especially in states that protect innovation and want to see that flourish.
Naomi, it's amazing to me that you say there are already a number of different ways that AI is impacting healthcare delivery today. And I want to get into some of those examples. But first, kind of, again, a general question. I think when regular folks out there think about healthcare, probably the thing they think about the most, the image that comes to their mind is, well, me sitting in a doctor's office, talking to my doctor, getting a checkup, talking through whatever issue I'm trying to resolve. And that interaction, it's almost kind of this iconic, almost cliche depiction of the healthcare system, right? You go in and talk to your doctor. Is AI going to change that? And I think maybe on some people's minds, the question of, well, is AI going to replace my doctor? Am I just going to, type into Chat GPT? Maybe the way we do today, we already Google our symptoms on like WebMD and try and diagnose ourselves. Are we going to do that with AI? Will it replace our doctor? Or is it just going to make my doctor better at their job?
Well, I think it might, in some cases, it might actually eventually, not today, replace some of the functions that doctors do. But I think also, very importantly, it will allow the doctor to do more of what they're supposed to be doing. They will spend less time taking notes and charting because AI can do some of those functions for them. It will allow them to be trained better in how to talk to you about your diagnosis, and perhaps showing them when they use the assistance of AI in describing your illness, the treatments, and perhaps some of your options going forward, particularly if it's a serious illness. It will assist them in that manner too, and it will also help them just spend more time with you, spend more time with the patient in the office, as opposed to frantically, running in 20 minutes late into the exam room, frantically taking notes, being distracted. It will allow them to be a doctor and do those things that they entered medicine to do.
Naomi, you wrote an article, I think it was last year, semi-recently, but in Discourse Magazine, that talks about one example of where AI could actually impact, or in this case, deliver a level of care. We'll include the link on our show notes, but the piece is called Life-Saving AI in Aisle 12. I'm going to read a brief excerpt and ask you to expand on it. You write, AI-assisted 3D mammography promises to be another significant advancement in breast imaging and screening. This technology is able to more quickly and more accurately analyze hundreds of digital breast images produced from multiple angles, offering more precise and detailed views of the breast tissue, which allows for earlier and more accurate detection of breast cancer and no increase in false positives. Can you talk about that example? I mean, that's a very specific way that AI is delivering, a level of access to care that we haven't seen before.
Yes. So when you look at what is being certified and approved by the FDA, like I said, there are more than 1,000 devices that are AI or machine learning assisted at this point in time. But the capacity of an individual radiologist to look at hundreds or thousands of pieces of data and information about your particular mammogram is just not humanly possible. Humans don't have that capacity, but they do have, a radiologist does have a lot of medical expertise. So whenever they use AI to help examine and evaluate the 3D mammogram, which has a lot more information and pieces of data than a regular one would, they are able to give a better diagnosis, detect cancer earlier, which is a key and very important factor in long-term survival of breast cancer. But also, whenever you think about this new technology, you can also pair it with what's available now. Like, for example, clinics that might be located in big box stores, like the Walmart that I spoke about in my article, where, if you think about, well, I had the personal experience where I had a mammogram that was scheduled in the fall and I had to reschedule. It took me like 3 or 4 months to get the next appointment. So the convenience of having it in a pop-up store, reminding women to get the mammogram, making it easier to schedule, basically a walk-in clinic, also impacts access to that really important care. And when you're talking about breast cancer in particular, and other cancers, individuals who are in lower socioeconomic levels tend to not have as easy of a time in taking time off of work and scheduling those appointments, paying for those diagnostics because of out-of-pocket requirements, meaning deductibles, things of that nature. So all of these things together can really create a system where care is more accessible and in many cases more affordable. And whenever we're talking about rural care specifically, we're already seeing the impact of AI and machine learning devices. For example, individuals who have diabetes and, are being evaluated because of their eyesight, might not know they have retinal myopathy right away because there is no ophthalmologist in their community. They have to travel to another place to get that diagnosis. And that often takes a lot of time. Sometimes it doesn't even happen because it's not possible or convenient enough. So now there is the technology to do that diagnosis using AI and machine learning remotely through telehealth, for example. And so those types of treatments, which were not available in rural areas, are now becoming more available. And we are seeing that in all areas of healthcare and medicine. And that's a great thing for the future of healthcare.
Naomi, it seems like you're touching on kind of two things. Number one is just sort of the physical proximity to, ways to diagnose or ways to access care. And again, this idea, if I understand it correctly, if I'm in a very remote rural area and I go into the local grocery store, like you mentioned in your article, it's a Walmart, I go into some kind of place and they have, I guess, a machine of some kind that does whatever the function is, but there wouldn't necessarily be a doctor physically present. They would be in a different location, say if their office is in a bigger city. But because of the technology and because of AI being able to assist in that, I'm able to get, I assume, the same quality of care is kind of the idea. Can you talk about that? It sounds like it just increases the physical proximity to patients in ways that we have never been able to do before.
So the advent of telehealth has made that much easier, and we saw that a lot during the pandemic, where, for example, stroke patients in one state were being actually assisted by stroke specialists in another part of the country. Those telehealth rules and the federal flexibilities allowed for a lot more interstate collaboration and treatment of patients across state lines. So that's one example. But adding in AI to this expands the treatment options that can be done remotely or even in person, for example, in a walk-in clinic. So you might not, you might be in an area where there isn't a cancer specialty facility or a specialty women's health clinic that would normally do mammograms, for example. I mean, most places have it, but let's just say that, the availability of it in a big box store does make it more accessible and easier to access. So we're seeing a lot of advances and innovations. Some of them are old school innovations, and some of them are absolutely cutting edge technology, ways of providing treatment that have never been available before. Way back before electricity, whenever there were in early civilizations, there was a way of doing telehealth in a way by using smoke signals to warn of plagues and things of that nature. So it's not a new concept, but the way that it's being rolled out and is available today is absolutely new and relies on newer technologies, but it's not a new idea.
I want to ask you kind of a two-part question about how this interacts with patients, because number one, just again, thinking of the things that patients go in and need care for today. What is happening right now? What other ways? I mean, you mentioned the AI tool for the mammograms and things like that, but what are some other ways that AI is factoring into patient care today? And then the second part is, what are we not doing yet, but we could see on the horizon soon in the future?
Well, so the average person is probably not having a lot of direct interaction with AI in health. So we do know that patients with very complex and severe illnesses, their physicians are using AI in many cases. For example, AI is being used quite a bit in oncology to inform the oncologist about a patient's liver function. A lot of that is done with AI. With you have a lot more data points, but the patient may not have any idea that that's actually happening. What we don't have yet is an individual's information available on this supercomputer that we carry around in our pockets now, where AI could actually, in the future, could actually customize treatments for patients from their phone. Now, that can be done now, but that's done in labs and, what have you. In the future, there will be a lot more integration of wearable information and data, one's own genetic information, medical history, prescription history, metabolic function. So all of those things in the future will be tied together, and you'll be able to access it from your phone.
Talking about on the provider side, because it seems like there's a lot of the innovation happening there, kind of on the back end, helping doctors, nurses, helping medical professionals to be more efficient, more accurate with these kind of diagnoses. When we talked in preparation for this episode, you mentioned something. This really stood out to me when we were discussing before, this idea of even using holograms to kind of help people being triaged. Talk about that. So I guess just give us kind of the big picture. Maybe it starts to sound a little bit like sci-fi, but what else is happening now, or maybe what's on the horizon as far as how providers are using this to enhance the care being given, or even from a training or education standpoint?
Last summer, I had the opportunity to visit the Mayo Simulation Center in Scottsdale. So Mayo Clinic is one of the world's leading medical institutions. They do what is considered to be gold standard training of their medical staff. They do a lot of innovations. It's tested, and then it's rolled out to other facilities around the world. So one of the things that they were doing is they were using holograms to train medical professionals in a lot of different scenarios. So if you imagine a medical student or a nurse who is getting training, the limitations of training are going to be on people, they're, actors playing out roles. Well, if you're able to do it in real time with holograms, you're able to test many more scenarios much faster and throw more things at the person being trained, and without actual real danger. For example, you might have a patient who's going through a psychiatric type of crisis, and you can do more role playing where the patient behaves this way or that way or this other way in real time, and really go through and evaluate it on the spot. So it was really fascinating to learn about these kinds of training technologies and modalities. Now, some of them were old school equipment to lift patients from their bed to the bathroom, for example, but some of them were hologram training. It was really fascinating to see. And when you think about the quality of training and the ability to run through so many different scenarios and new scenarios that are popping up, you're able to better train that individual. It's like, for example, and we also saw we saw the surgical lab as well, where you're able to, you don't want your surgeon to, for the first time, come upon a very tricky situation when they're operating on you. If they do it in the surgical lab first 30 times, you're going to be in much better hands at that point. So these are the kinds of trainings that are really, I think, going to change the experience for the individual patient when they go and get care. And part of that training, I know a lot of people might feel like they're not getting high quality care because maybe their doctor isn't as skilled at communicating. That's also something they can practice, where, one physician can't be all things and know all things and do all things. But with these kinds of trainings and these kinds of scenarios, it can certainly help them.
I want to shift for a minute to the public policy landscape because obviously, as I see it, there's kind of two big components of this conversation, and I think that's probably true for any area that we talk about AI in other kind of areas of life or other policy areas. But there's the first big question of, well, how is this technology going to change my life directly? And as you've laid out well, how it can impact care today, what's on the horizon, the way providers are using it on the back end to enhance diagnoses or to train and educate. So that's obviously a huge bucket of the impact and the potential of AI in our lives. But the other side, it seems like this keeps coming up in this issue area, is sort of the public policy response. And really that means the potential regulatory response. Folks at the state or federal level starting to ask questions, often well-founded questions about things like privacy and data collection and protection and those kinds of things. But of course, it naturally starts to veer into, well, what should be done in terms of regulating this new technology? So I want to kind of go through some of those things so we can know kind of what the landscape is and how we should be thinking about it. You've argued before, and we'll get into a toolkit that you actually put together, but you've argued that, well, a lot of these decisions should be made at the state level, not the federal level. Can we start there? Can you talk about kind of the state-federal interplay? Why do you, I guess, have more confidence in, or just think it should be state legislators making these kinds of policy decisions impacting AI in healthcare rather than folks at the federal level?
Well, sure. So to clarify, it's not just that I think that it should be at the state level. States do have authority over the practice of medicine, which is an incredibly important power and responsibility that lies in the hands of state lawmakers. That's already the case. So, that does make healthcare different than some of the other policy areas that people might already, have some knowledge and expertise about. The second reason is that state constitutions can be used with legislation at the state level in order to go above and beyond federal protections. So whenever we talk about, for example, life, liberty, pursuit of happiness type issues, state constitutions can go above a federal floor of those protections and actually enhance those within the state. Same thing holds for free speech. Whenever we think about free speech, states can go above and beyond federal protections as well with their constitutions, and in fact, all the states do. So that's why the states have such an important role when we're discussing AI in healthcare. I know that there is a lot of fear around the potential dangers of AI, and obviously those need to be taken seriously and addressed. But whenever we're talking about what is it that should be done, a lot of those decisions will be made at the state level.
So I normally ask these kinds of questions in terms of, well, what should we do? How should we be thinking about regulation or public policy? You actually have kind of answered, at least started to answer a lot of those questions. You put together a toolkit called AI in Healthcare 2025, a toolkit for state lawmakers. It's a pretty comprehensive document, again, that we'll include in the show notes for anyone out there interested, especially anyone in our audience who is a state legislator, kind of works in that space. It's pretty robust. And so one, Naomi, I wonder if you could just kind of summarize in your toolkit, what are the key themes or the key recommendations? Just kind of give a good introduction of this to people in the policy space that are looking at what they should do.
Yes, thank you. So what I wanted to do is I wanted to provide some concrete ideas for how to protect innovation in the AI space, and also some ideas for allowing it to flourish. And so what I do is I lay out some ways that state lawmakers can act today in order to make AI more accessible in their state.
So the toolkit does include some model bills. Can you run through some examples of those? And particularly, I'm thinking in terms of state lawmakers who are relatively new to this issue, and they're kind of thinking, well, I'm hearing from my constituents, I'm hearing some questions or concerns. There's also obviously some potential and excitement around this technology. Where should they start? What do you propose as far as model bills? What should the state start doing that you have outlined in your toolkit?
I have a wide range of ideas there, and these are starting points. I mean, we're very early in AI and what AI is going to look like and do in the future, but this is a really important starting point for lawmakers. One of the things I'm most excited about in the toolkit is this idea of using AI remotely. So think about, this is probably already available in some ways in Utah, where you might have an emergency room that's remote, that's actually a patient might be in their own bed at home or in a hospital bed in their own home, being remotely monitored by the ICU staff at a hospital. This is a way that allows a patient to be more comfortable, be surrounded by loved ones, but also uses technology to intervene and be more proactive in the event that, for example, let's say that the patient's blood pressure is starting to drop. Maybe there are some other symptoms that are appearing simultaneously, where where there might be signals sent to the ICU staff that intervention is needed, and it can be done early, and it can be done in a way that doesn't allow the patient to further deteriorate. Hopefully, at least that's the goal, keep them stable. Whenever we're talking about every state is facing an aging population, and this is particularly important for state lawmakers because the states will be footing the bill for long-term care under the Medicaid program. When an individual is going into a nursing home on Medicaid, that's something that is going to directly impact state budgets and will also be competing with other state priorities like education and transportation, for example. So if you allow for more remote monitoring of patients using AI and machine learning devices that are already FDA approved or certified, then you can allow people to age in community. They will have more choices on where they live as they get older. And quite frankly, when people have choice over their own lives, over their own care, they will do better. And so you can delay moving people into facilities or even keeping them out of them completely with this type of technology. So I would have state lawmakers, especially new ones, look at some of those ideas. Another idea that's in the toolkit, and I have model bills for these proposals that are really important starting points. But one of them is, we know that there's a lot of interest nationally at the federal level in looking at and evaluating where taxpayer dollars are going, how it's being used. And a lot of the work that I've done really, and I apply it here in the toolkit, would call for using AI to basically audit and evaluate the programs that Utah taxpayers are currently paying for in the healthcare area. So what most people don't realize is that there are dozens of programs that are run by the state. But unfortunately, a lot of those resources are going to support a bureaucracy and not necessarily reaching patients, and not reaching the patients who need that care and assistance the most. So what I'm proposing is that more evaluation be done on the back end of these programs that are either federal programs administered at the state level or state programs, to find out who's eligible and not getting benefits, who is not getting the benefits that they should be getting, what can and should be done going forward in terms of making sure that these resources that taxpayers are paying for are actually reaching the intended recipients and in a way that really benefits them.
Naomi, one of the things that comes to mind, again, when we're talking about the regulatory environment and what states should do, there's some very kind of practical questions that come to mind. And in particular, I'm wondering, should it be legal for AI to diagnose me? I mean, if I plug in, again, I said at the outset, we plug in our symptoms already online, just get information. And then I've been one of those probably annoying patients who doctors before saying, well, I read this online, could it be this? But if I do that now with sort of some kind of enhanced chatbot in the medical space, just let's talk through that. Should it be legal for AI to provide diagnoses to patients?
Well, it can already be legal. So there are a couple of important policy questions and guardrails that you would want to have around that. But let's take, for example, you can use your phone on your child's ear to diagnose an ear infection in some cases, for example. So let's say that you do that. Now, you want to make sure that their primary care doctor is aware that they've gotten another round of antibiotics, for example. You want to make sure that you understand as a parent that this is AI diagnosing and not a doctor. You might have oversight from a doctor ultimately on the signing off on it, or a pharmacist even. So it's already possible. It's just what are the laws? What are the laws that are in place that allow that to happen, and what guardrails should be established? And I think most people, would want to know, for example, that it was AI and not an actual doctor in those cases when there is no doctor, when it's truly autonomous. But in most cases, there's going to be someone on the end signing off on it, and you want to make sure that your doctor, that your child's primary care doctor, knows that they have had another prescription for amoxicillin, and that they're not getting 3 in a row, making it completely ineffective, for example. So it's already possible to do that. When we're talking about autonomous AI, I do have in the toolkit that for a state self-insured plan, for example, the plan that most lawmakers around the country are under in their own state, that they be allowed to do that if they consent to it. I think that in a lot of these cases, as long as you have consent of the patient to have AI, for example, let's say that you're asking your physician for a training for a training plan for exercise. And let's say that your doctor pulls it from AI, they should tell you that it's AI created and that, they didn't create it themselves. But beyond that, is there really anything else that would need to be done to make the patient feel comfortable and to make it and to where it should be legal? And I think those are the kinds of things that one can and should think about, but it's already possible.
Speaking of guardrails, two other things that come to mind are, I'm sure people have questions about privacy, either the information that they're sharing or even their own data. Kind of having some reassurance that my data, my information is still private if AI is playing a bigger role in the delivery of care. And the other that could be of concern for some folks is kind of the question of bias. Is AI going to introduce different types of biases that maybe weren't there before, or is it a solution to those kinds of things? So in terms of privacy or bias questions or concerns that folks may have, what are some of the things that you've seen come up in the debate around this issue, and how would you say we should best respond to them?
So the privacy issue, and those are both excellent questions and have to be addressed seriously and thoughtfully and are not going to be solved immediately. But when we're talking about the privacy issue, we already have multiple layers of privacy laws. I think that it is worth going back and readdressing them and understanding what they protect, what they don't protect. But there's a lot of misunderstanding about privacy laws as it is right now. And, there is a limitation on privacy protection ultimately. So that is something that, should be acknowledged. Even when large data sets de-identify patients, there's always a risk that there could be a privacy violation. And so, acknowledging that, I think, is very important, and understanding what those limitations are is very important, and understanding, very importantly, that HIPAA is not a blanket for all of your medical privacy. It's absolutely not. It's actually pretty limited, but there are other privacy laws. So when we get to the issue of bias, this has been one that unfortunately has been used to fearmonger and scare the public about AI. Now, is there bias? Yes, absolutely. There's always been bias in when it comes to medical treatment. For example, we know that people with in lower socioeconomic areas, in urban areas and rural areas, they don't have the same access to, for example, clinical trials that many of us would have access to living closer to a large urban area or an academic research center. So we know more recently that the pulse oximeter, which is a little device that measures oxygen saturation, did not do a good job for individuals with darker skin during the pandemic. That it was discovered during the pandemic. So African Americans, their oxygen saturation was not being measured accurately in many cases. And so more recently, the FDA had approved another pulse oximeter device with a warning on it about the limitations. So AI is not uniquely biased. It's that there are limitations on the information that you use, but there's also the potential that AI can be far less biased because there's a possibility of using more points of data from more individuals in order to do medical evaluations, to spot anomalies in the individual patient's data in order to customize treatments more accurately for an individual person. That's where the most exciting parts of AI come in. And when you talk about bias, we've been using evaluation processes that are based more on population data. And whenever we get to AI, we're going to be going more local, more individual, which is also going to, I think, dramatically offset any biases that occur. So, realistically, there's, there is no perfect approach where the AI is at a point where it's not going to have any bias. But I do think that in many cases already, the validation that can be done using AI is going to be far superior to the methods and approaches that we've historically relied on in these particular areas.
Shifting gears for a little bit, but kind of staying still in the lane of medical care, because you've mentioned a couple times Medicaid expansion and kind of how that factors in, because the Medicaid program obviously is a significant part of just our medical care infrastructure in this country. And you've also written about AI in the context of welfare reform and reforming our social safety net programs, Medicaid being one of the biggest of those. I wonder if you can talk a little bit about AI. Can it be deployed to help improve things like Medicaid or even other areas of our federally funded social safety net in a way that can either save taxpayer dollars or improve outcomes for the people using these programs? Any thoughts on the potential there?
Yes. So right now, it is possible to use AI to do a lot of work on the administration of the program. For example, we know from Medicaid expansion that there has been I'll use the term fraud, but it's not necessarily intentional fraud. I'll just use that caveat. But for example, let's say someone is enrolled in Medicaid due to expansion and they move to another state. They didn't disenroll, but they're enrolled now in their new state. They're enrolled in 2 states. Without doing a redetermination process, it's going to be impossible to know. And many states pay the health insurers based on a flat amount for each patient, depending on what kind of patient it is, their age, and, for example, whether or not they have a disability. So using AI could be extraordinarily effective for redetermination, determining who's still eligible. And people think, a lot of people are very much against the idea of doing redetermination at all. But what I think a lot of people aren't thinking ahead about is that we're dealing with a program that has limited resources, where in too many cases, the most vulnerable patients are put at the end of the line for services. There aren't enough providers. So when the idea of applying AI to the facilities and the practices that are treating these patients, there's enormous potential for creating much better outcomes for Medicaid patients, which unfortunately Medicaid does not have more positive outcomes than no insurance in so many areas of care today. And that's for a whole lot of reasons, but we do know some of the reasons. And so, using that to help address those outcome disparities would be tremendously valuable and helpful. We've really got a situation where we are deploying enormous resources at this idea of insurance, but it hasn't really been the goal yet to really hone in on the outcomes for these patients. So part of this is going to involve making sure that these limited resources are being put towards actual care for patients, not being spent in the bureaucracy of a program where each layer of government takes a cut off the top to fund their own administrations to administer the program, where perhaps the resources are being spent perhaps in the wrong areas of care and not where it'll actually deliver the most value. So I think that we're really we don't have the political appetite for this yet, but we will get there eventually. I mean, and one of the things I put in one of the ideas I have in the toolkit is to actually, allow far more use of AI in healthcare, for these self-insured plans. So once you have the proof of concept for the plan that the lawmakers are using, then it will be easier to use it in the Medicaid program. A lot of times, lawmakers won't deploy something in Medicaid first because of this idea that, it's second rate. You don't want to shortchange those patients. But on the other hand, the self-insured plans that lawmakers participate in, those are the Cadillac plans. Those are the plans that everyone would love to be on. And so if we have the proof of concept there showing effective outcomes and lower costs for particular types of care, then it will be much easier to deploy in the Medicaid program. And I think eventually, in the very long run, down the road, what you will eventually see is a use of AI to take a patient or an individual and evaluate what are their needs, what are their the specific things that need to be addressed and managed for that patient. For example, are they pre-diabetic? So putting resources into that specific area of care for them, where right now it's really not a program that is meeting the needs of those individual patients.
Naomi, we've got just a minute or two left. And so I want to ask you to kind of wrap things up. Let's say I'm a state lawmaker here in Utah, or another state for that matter. What's the one big thing I should do right now? If you were talking to legislators, and they said, well, we want to move forward in this space in a way that's thoughtful. What's the one thing you would say, here's what you do starting tomorrow, go?
So Utah is in a really terrific position to protect innovation in AI and actually expand it to use more in healthcare. Utah has an AI sandbox where this could be deployed very quickly, and state lawmakers could use those examples and expand them legislatively. One of the most important areas where I think that state lawmakers can act is going to be in this area of long-term care for the aging population. By setting up the systems, putting them in place today, they will be ready as people begin to retire, allowing them to age in community. That would be a phenomenal step forward for any state, and particularly Utah.
Kind of the last question is, it's speaking to sort of regular folks out there, just voters that are listening to this discussion. What should we expect moving forward on this issue? How will kind of the interaction that each of us have with healthcare change thanks to AI? Just give us a quick sort of preview of what's next when I go to my doctor, or when I see these debates play out in the policy sphere. Give us a little prediction of the future as we wrap things up.
So I think as we look to the future, I think you can think about how it is now, where you use Dr. Google to Google your symptoms. But in the future, you will actually get medical care by using an app, for example, or having a better experience and interaction with your physician in real life.
Well, Naomi, we will have to leave it there. This has been great. Again, there's a lot to be excited about. There are obviously some thoughtful considerations for folks in the policy space to make sure that we're approaching these issues in the right way as a state and as a nation. And just really grateful for you sharing your time and expertise with all of us here at Defending Ideas. So thank you very much for your time.
Thank you so much. It's been a pleasure.
Once again, that was Naomi Lopez, founder and principal of Nexus Policy Consulting, has done a lot of tremendous work on the healthcare space, and specifically AI in healthcare. We're going to take one final break before we leave you all some quick talking points. This is Defending Ideas. We'll be right back.
Sometimes it's hard to keep up with the latest policy debate that affects your life. The solution? Subscribe to Sutherland Institute's weekly newsletter, where you'll find in-depth insights from seasoned policy experts, compelling multimedia, and advance notice of special events. Visit sutherlandinstitute.org.
Welcome back. The impact of AI in the world of healthcare certainly raises important questions. But I think there's more cause for optimism and excitement than fear, especially if we approach this new innovative technology in the right way. This is an excellent example of how the innovation made possible by our free enterprise system is changing our lives in profound and positive ways. And I think the key takeaway from our conversation today with Naomi is that we need to equip voters and policymakers with the right framework for states to lead with smart, principled policies that both protect and encourage innovation and improve the patient experience. Well, that's it for this episode of Defending Ideas. If you enjoyed this discussion, please visit defendingideas.org, where you can access previous episodes and watch or listen on your favorite platform. Don't forget to subscribe to Defending Ideas on Apple Podcasts, Spotify, YouTube, or wherever you like to get your shows. And please share this episode on your own social media profiles or with a friend, family member, or coworker who may find it interesting. And lastly, if you want to support the broad work of Sutherland Institute, if you want more conversations like this, please make a contribution at sutherlandinstitute.org/donate. Thanks again for joining us on Defending Ideas from the Sutherland Institute in Salt Lake City. I'm Nic Dunn. We'll see you next time.